Hello, everyone. My name is Danny Ryerson. I work at the Carl R. Woese Institute for Genomic Biology, and we're putting together a series of videos trying to look at some common questions and concerns people had about the COVID-19 vaccine. So a little bit about myself. I have a PhD in molecular and integrated physiology from the University of Illinois at Urbana-Champaign. And we also wanted to talk about our concerns that we had when we were looking and starting our research in determining if we wanted to get the vaccine. So my biggest concern going into it, or at least starting out my research, was we heard a lot of stories about people having really severe side effects from getting that second dose of the vaccine. And so that was a kind of a concern for me. It turned out to not be a big deal for myself, but I know other people do have large side effects. You can get a fever, you can get chills, things like that. But it seemed like it would be worth it for myself. And the reason why I ultimately decided to get the COVID-19 vaccine was to be able to safely visit my family and friends again and try to get back some of that normalcy. You can see in the picture up on the left, there's my nieces here. They live up in Chicago. I was really excited to be able to go visit them and see family again. But I wanted to make sure I was able to do it safely and not putting anyone at risk. So that's kind of what ultimately drove me to decide to get the COVID-19 vaccine. All right, so going into it, the first big question we usually get is, will the vaccine actually protect me from getting the coronavirus? And we actually put together a short video here to look at the efficacy of the vaccine during the trials. And so what this does is we actually use red candies here to show the rate of COVID-19 cases in the US. And then the highlighted area here is looking at the time period during which the Pfizer trials occurred. So that was between July and November of 2020. And so what we see here is with the yellow candies, you have people who got during the trial who got the vaccine, and then the blue is the placebo group. And these red dots are COVID cases in those two different groups. And then here we're going to look at the same things with the Moderna trial. You can see the time periods, which were almost the same. And again, you'll see there were significantly fewer people who received the vaccine that ended up contracting COVID-19. And then this next thing I want to pause here was looking at the Johnson & Johnson trial. So a lot of people have talked about the efficacy of the Johnson & Johnson trial and tried to compare it to the Moderna and COVID efficacy rates. And one thing to keep in mind with that, and why direct comparisons are hard to do, is the time periods during which these trials were undergoing. The Johnson & Johnson trial was occurring at a time when rates in the US were spiking. So there was a lot more people getting infected. So it makes direct comparisons between these two vaccines, or the three vaccines, a little bit more difficult. But when we look at the data, you see that even though the efficacy numbers don't look as well, there are still significantly fewer people in the Johnson & Johnson trial who ended up contracting COVID when you compare it to the placebo groups in there. So all three of these showed great efficacy. They helped greatly reduce the risk of contracting COVID-19. Also, all three of them were 100% effective preventing COVID deaths. So this was in vaccinated versus placebo groups, how many people ended up dying of COVID-19. And no one who received vaccines in any of the trials ended up dying of COVID-19. So that is a great plus, or a great important part of a vaccine. And we included this here. Vaccines are significantly more available now than they were in the past when it first came out. And vaccinefinder.org is a national way to try to locate spots where you can get your vaccines. There's also local ones available depending on your location. So this is a lot of information about what happened during the trials, but now we wanted to look at real world efficacy. We've had a lot more injections, and in the trials, we had about 40,000 participants in each of those trials. Now we've given significantly more doses out, and we want to see, do these rates hold true even now in the real world? And what we see after about 100 million people being vaccinated, we've only had about 9,245 people getting those kind of breakthrough cases that people sometimes talk about. So that's over a 99.99% effective rate at preventing you from getting COVID-19. In addition to that, of those 9,245, only about 30% of them were asymptomatic. You had no symptoms at all. And those people that did still have symptoms, they were significantly lower than, and significantly less severe than people who are unvaccinated. So overall, the vaccine will protect you from COVID-19. The next thing we want to talk about, a big question, is what can I do after I'm vaccinated? So we showed that you're at a much lower risk of being a carrier of COVID-19. You have a greatly reduced risk of getting that at all. So that means, according to the CDC, you no longer need to quarantine after exposure because you're much less likely to contract it. In addition to that, you're also, your viral load, those people that did have those relatively rare breakthrough cases, your viral load is much lower, so you're less likely to spread it to others. So you have a reduced risk of spreading it to other people in your social circle. So that suggests that, and according to the CDC now, you're able to, after you're vaccinated, in 2 weeks after you're fully vaccinated, you're able to resume activities without masking or staying 6 feet apart from friends and family and anyone. The one caveat to that is, except where you're required by federal or state or local laws, or private properties are allowed to have their own mask requirements and safety requirements. And so here's a list from the CDC website of the things that they say fully vaccinated people are allowed to do. And if you look on the right-hand side of each of those columns, fully vaccinated people are can pretty much return to normal and do most things safely again. If you're unvaccinated, they do still recommend you take precautions. You have to wear masks in a number of situations, and you want to try to avoid the riskier situations like large indoor gatherings and things like that. Those should be avoided altogether. Another big question we get about vaccinations is people have worries, and they're like, can I just wait it out? And if everyone else gets vaccinated, can I not? And we try to encourage people to go out and get vaccinated, because it's going to be very difficult if everyone doesn't try this. To get to herd immunity levels that will try to help protect everyone, we need somewhere between 70 and 90% of people vaccinated. Currently, we're about 37.5% nationally that are vaccinated. And so what you can see here are some examples of simulations about if different percentages of the population become vaccinated, how likely is COVID-19 to spread throughout the rest of the population. And you can see the more people that are vaccinated, these dark outlined hexagons, the more we can protect. They kind of act as a backstop to prevent the virus from spreading to other people. So if we can get to those 70 to 90% vaccinations, any small people that do get small cases of COVID-19, they're unlikely to spread to the rest of the general population, because they'll run into that wall of vaccinated people and the virus can't spread. The last big question that we get a lot of times is, how long will immunity from COVID-19 last? How long does your immune system work, or will it stay effective? What we can say now is it's definitely at least 6 months. We have data from about 6 months after the vaccines go out. Likely it'll last longer. Most projections are about a year or so at least. Probably not the same as like the long-term things like measles and some other vaccines that can last 10 years. These ones, they're thinking that it could be probably over a year, but sometime less than that, but we just don't have the data to know exactly when we would need that. But we do have data from a number of different, so this data, it says the University of Texas Medical Center and the University of California Medical Center. Those are with doctors who are vaccinated. These are people who are working with COVID patients daily, and you can see they are still, for the most part, protected even 6 months out. But it is possible that we might need boosters in the future going forward. And then if you've already had COVID, the CDC does still recommend getting the vaccine. It's unknown. There's some data that shows that the antibodies from natural infection can last a few months. The original estimates were somewhere around 3 months, but they're not really shown to be very long lasting in some people. And the vaccine protects for a longer period of time from the data, as well as it protects to a higher extent. And it protects against a larger, it protects against more of the variants as well, which is some of the natural infections don't necessarily protect against other variants of COVID-19. All right. And with that, if you guys have any other questions, we're here. We're very interested in helping answer questions about science or COVID-19. You can email us at outreach@igb.illinois.edu, or you can find us on Facebook and Twitter and Instagram at IGB Illinois, or our website is igb.illinois.edu. And I hope you all stay safe, and thank you for listening.